Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning.
Well, good morning.
So what's this
Dobre
all?
utra.
Dobre utra. Buenos dias.
Buongiorno.
So what's this W stuff? I hear that this morning we're into W's. What
The
does that
W,
mean?
the 3W. The wonderful world of wellness.
Okay.
And the
That's,
5W.
what's the 5 W's?
The who, the what, the where, the when, and the why.
Okay. Is that about you?
We're
What
going
is
to talk
that
about the 5W of implants.
Someone told me that your organization's going to have a big open house in March. Tell me about that.
I love medicine. I love healthcare, and I love business. And
you
I'm
love
always
people.
think I love people. Oh, that's why I became a doctor. I was
Right.
going to be a psychologist, but I say no, keep going and become a doctor. You keep thinking like implants. We do implants, but it's usually for the elite because it's expensive. Implant can be very expensive, and I met this guy that has is part of this big company of implant equipment. And they bring all the products, everything.
Dental. Let's this isn't implants. They're breast
no
implants.
breast implant
No,
and
we're
butt
talking about-
implant.
right.
Dental.
No, dental. Beautiful
Dental
dental
implants.
Okay, get that straight.
Yeah, get that. Chewing, chewing. So, we always talk about how important teeth are for digestion, for your health. If you don't have your teeth, when you bite, you either going to take longer to chew your food, right? Psychologically, if you don't have your teeth, especially your front teeth, right? You won't smile. It sort of restrict you from going out and dating and doing things. So teeth are very important socially, psychologically, and health-wise because it's part of digestion. Digestion starts with mastication, with chewing. And so this company came by and, they are sitting down and they want me, as the medical director of the company, I have to sign on the dotted line. And I'm looking at the equipment and I say, you guys are not bad with prices. Why don't we partner? And if we partner, we can do really good to people that need implants that cannot afford it. So we decided since we have 2 centers, we're going to have 2 open house or 2 seminars on implant. And what AGI is gonna do is one of the event is going to be March 24. They are both on Fridays. March 24.
Starting at 3 o'clock.
At 3 o'clock. So
wait, I have to ask you a question. It starts
that's
at
on
3.
Hagen Ranch.
It goes to 5, and then when do we get the wine and cheese?
At the beginning, right from the get-go. The moment you walk in, go for the wine and cheese. But when you walk out with the implant, you're going to be able to eat the cheese and the and the salami and everything, and the turkey.
And you're having them 2 different days, right?
2 different days. So the Friday, March 24, pencil talk, write it down. Friday, March 24. Even if you don't need implants, believe me, from now until that day, you are going to see a person that, this person should go. I can see that person can utilize good implants and, and if you cannot afford it, this is the time for you to learn everything that AGI and this company can do for you. And Hagen Ranch is 12453 Hagen Ranch Road, Suite 101. If you get lost, you might end up in Publix, but that's okay. Just walk right out. It's only one way in, one way out. We are right next to Publix.
Well, let me help
It's
you.
in
Let me
Boynton
give
Beach.
people directions.
Okay.
But, it's very easy to get to. You really want to go to The way I go is I take Woolbright all the way from Federal Highway.
Me too. Yeah,
Yeah,
Woolbright.
all the way there to Hagen Ranch, and then you just go
Then
a little
you go-
bit. You go to the left.
You go left.
And
And
it's
then
there. The beautiful shopping center.
The
new
shopping center is on your
Publix.
right. Right.
Right. And you're at the very end.
At the very end. So
Very
you don't even
end.
want to go into the shopping center.
Right.
You want to go to the end of the shopping center
yeah.
and
Well,
then
there'll be a
turn
lot
right.
of cars. You'll have some
It's a lot of
balloons
cars.
or things
Now
to
you
show.
want to RSVP because it's limited. The amount of people we can see, and we want to make it productive. So if you want to go to that one, that is the first one, you have to RSVP as 561-270-6494. Do I sound like a good announcement or what?
561-270-6494. And that's Pencil Talk Radio. Remember,
Pencil
write
talk.
it down.
Write it
Write
down.
it
Sharpen that
down.
pencil. If
Right,
you
sharpen
run
it.
out of ink, give us a call and we'll repeat it for you.
Okay, now the other people.
If you run out of ink, take your needle and put some blood out and write it with blood, because this is going to be a lifesaver.
No, it's really. You see, wait. I want to. We get serious a bit. Let me get serious here.
The Italian on me is
Yeah,
coming out.
I tell you, Dr. Mencia is on a high. Here it is, 7 a.m. Very few people are like that, on so energetic. But I want to talk about why this is really important, because you kind of touched on it. But as you said so correctly, Dr. Mencia, for years, implant really was a dental for people who had a lot of money. And every time you see somebody who really looks good, and as they're starting to grow older, most of them have dental implants, because false teeth are a thing of the past. There's some
False
people
teeth.
that have them, but it's not a good thing.
No, it's not a good thing.
And there are people who have, and you told me about this before, and I think Dr. Rosemary did. There are people who do have dentures, but then they have some implants to hold the dentures in.
Exactly, those
Right?
mini implants.
Yeah, so
snap on.
Yeah.
Snap on, snap off.
That's right. So implants have really come a long way.
A long way.
But now it's wonderful that you have figured out how people can now have the implants and have them at a much more reasonable price. And
even if, let's say, you have a bridge, the bridge is what we used to do before implants came out. And if you have missing teeth, we will take the 2 teeth that were proximal to the area that you have missing, and then we will open those tooth up and then put a bridge in there. Mm-hmm. But food tend to get stuck in there, and you cannot get it out. And it's bothersome to people sometimes. So even if you have a bridge, you might say, let me go and find out what they can do for you. Because if you have bridge, we can, cap those 2 areas that they use as a base to set the bridge down. And then in the open space, we can put implants. The good thing of the bridge is that keep the space open. The teeth won't migrate. Because when you have a tooth pull out, teeth tend to migrate. They look for each other. They come to proximity. And it is difficult. Nowadays, we can fill in the spots so that we have enough room. It's like building a bridge. You put all the cement down, then you put your bar, and then the implant comes out. So we can put bone graft in there. If you don't have enough reach for the implant, we can do bone graft. It's a process, but at the end, people are very happy with their implants because it becomes their teeth now.
And it's really painless because, as Dr. Rosemary said, it's a sedation. People are relaxed, and they're able to come in and then almost leave pretty much with something there. So that's unusual, too. I think years ago it used to be over months and months and months, and they had to get it prepared and all, but it's not the way it is now.
And when they are doing the implants, because we are unique in the fact that we have medical and dental working hand on hand. So when the patient is there, the other day, Dr. Rosemary and we were doing a case, and the patient blood pressure went sky high. So I had to step in and give the patient medication, bring the blood pressure down. We were not successful. We kept doing things. I would not allow nobody to touch the patient until that blood pressure will come down. We canceled the case. We cancel the case. Say, no, we have to control the blood pressure first. And then we'll go ahead and revisit your implants. And how many times have you been to a dentist that they're going to go around checking your blood pressure?
Oh, you're absolutely right.
No, so imagine this guy's blood pressure was 170 over 110. That's extremely high. Write it down, 170 over 110. When you go to your doctor, ask, is that high? That's extremely high. You don't want a needle to go into any part of your body, with blood pressure that high. So even though, we were going to do sedation, I said, no, we are not doing that case until we get the blood pressure under control. So I'm going to be there so that if you have medical questions, you can then go to your primary and ask, or you can just switch to us and we'll take care of you. No, I'm just kidding. But you can go to your primary. But while I'm there, I'll be your primary. I'll be there to answer any medical issue that you may have. So that one is on March 24, Hagen Ranch Road. The other one is March 31st, the following Friday. And that's going to be at the office in Fort Lauderdale, 1608 East Commercial Boulevard, Fort Lauderdale, Florida. And
that's where your main office
hub,
is, the AGI.
The main
hub. It's a hub. Oh, it's a hub, right.
I'm going to the hood with my main hub. And the phone number there to RSVP is 954-489-2517. RSVP, call in and talk to one of the staff and tell them you want an RSVP because, again, it's limited on how many people we can have. You are going to have hors and wine, and it's going to be fun. I'm going to be there. It's going to be very educational. We're going to be talking about implant. We're going to educate you first, and then you're going to have opportunity with pricing that you will not have after the event. During the event, you will have opportunity with pricing at both offices because we're going to partner with this company to try to help those people that have been trying to get implant but cannot afford it because they are too expensive.
And how about demonstration? We're going
to have everything.
Demonstration.
Right.
Because I remember you once came to our Cure Symposium and you really showed
what could
happen. That was the most amazing thing. You can do something like that?
We are going to do those kind of things.
Everyone needs to see this. Yeah. You would not believe it. People couldn't believe that same woman within
it was the dental manager. Wasn't the dental manager?
Yeah, it was amazing.
Amazing.
What she looked like.
What she looked, the before and after, live.
Oh, I couldn't believe it. And so that...
Coming to you live from AGI.
Well, let me just say something that you said is very important. No dentist has a doctor. No dentist has a doctor around. And even though this is an easy kind of thing, there are people who do have high blood pressure or other things that... the
other day we had Dr. Cunningham, you remember? Yes, she came as a guest.
Yes.
And she's an implantologist. And she was going to do a case of this basketball coach who is on a blood thinner. And she was a little bit concerned. She said, "Would you please check the blood thinner level, the coumadin level on the patient before I touch him because we're working on the implant today." And we went there and the level was not that bad and she was happy. Sometimes it can be bad and we have to postpone, but at least she was comfortable because I was objectively able to give her a number and say, no, the coumadin level is excellent. It's not super high. He won't bleed a lot. You're going to be okay.
Oh, because bleeding is another important thing.
Absolutely.
And then people, what about infections? So you also give them
We also give them antibiotic. Sometimes we can give intramuscular antibiotic. We work in conjunction so that we make the operator, the surgeon, need to be comfortable when you're doing a procedure. So we are there to assist the operator, to assist that surgeon in what they're going to do so that they are comfortable. And, I always talk to all of my dentists, and I say, listen, you have to leave your pride and your honors in your car in the parking lot when you step into AGI. And they have learned that we are, that I'm a very humble man. You can ask me any question, and we're going to talk professional to professional. And sometimes they come and they ask me. I had a patient that was on certain medication, and the dentist said, it was metronidazole and other medication for rheumatoid arthritis. So he was concerned, and he said, do you think, taking metronidazole and then taking this other medication, any drug to... So I went in the computer, I showed him, no, there's no drug-to-drug interaction. It's okay. So he said, any problem with the bones? Will this be affecting the bones before I even touch the patient? Because I don't want to offer him implants on that patient and then knowing that the bone is going to be too mushy and nothing is going to pick up. And I said, no, there's absolutely no worry with the bones. Versus a person that is taking, some of those osteoporosis medication, Fosamax and that kind of stuff. So it's incredible how involved medical and dental need to be. And that's why, when I opened the center, I say, we need to work together for the well-being of the patient. And you get that, a lot of patients. We have heard a patient here in Boca that had gone for procedure and died on the table, because of the way the anesthesia was being applied. There was no monitoring for, you need a medical doctor next to you. We need to work together. And rarely I get from a outside dentist that will send me one of my patients and say, will you clear this patient for surgery? You don't see that. But the eye doctor say, go and see Dr. Mencia so he can clear you for your cataract surgery.
See? Well, dentists need to get smarter.
Right.
Right.
Orthopedic doctor, go to Dr. Mencia. The dermatologist going to do more surgery or anything like that. Go and see Dr. Mencia, get clearance, and then come back to me. So clearance means that we do a full checkup, including your vital sign, your blood pressure, your pulse, your electrocardiogram. And a lot of time the patient asks me, it's a simple cataract surgery. What do I need clearance?
It's not a simple
cataract surgery. And I say, well,
surgery.
My job is not to get you to the surgeon, is to make sure you get out of the surgery. That's what my job is all about.
Well, and also to get out with a successful operation.
With a successful operation, right.
Because there are so many factors, as you always say. The thing I admired about you when I first met you is that here you have this medical practice and you have a dental practice, and it's been expanding. Since we started working together, your dental practice has really expanded. You, of course, didn't have the Boynton Beach office either.
Right.
But that dental practice is amazing. I mean, it's gorgeous. It's like a salon. You really have done a great job.
As a lot of times, my patient, say, how you come with this idea? I say, I didn't. My patient gave me the idea. It wasn't my patient. I say, Dr. Mencia, you have a wonderful setup down here. Why in dental you only have general dentists? Why don't you do other things like you?
Really?
I say, oh my God, you're so right. I was missing the boat at the beginning.
It was just plain dental.
It was
tried
plain
to give
dental, and I said,
and
that makes sense. Bring the implantologist, bring the person that work with the soft tissue of the mouth. So then we started growing the dental department, putting all these specialists working together, and it's wonderful. It's a wonderful service because we all get to talk together, the general dentist and the specialist, the implantologist. They all get to talk together. The medical doctor is there. We all talking, and if it's a simple, easy case, we all move along our way, but we are there with each other.
Well, go ahead and tell me about something that you said about the bone. So sometimes you get in and they need more bone in their mouth than is there. What happens there?
Because what happens sometimes when you extract, when you pull a tooth out, there's a big hole left behind. So if you have a hole, you cannot basically put an implant if it's too large. So what we do after the extraction, right after the extraction, before we do any closing or anything like that, we put bone graft in there. So we fill the empty space with bone. So now you still have a nice ridge. Now we let that heal, And when that heal, that bone become part of your own bone that you were born with. And now when we go back in there to start the process of the implant, we have a good base so that implant will last you for the rest of your life.
Well, you remind me of something. Dr. Leon, of course, has just come in. He's our orthopedic surgeon. He's going to talk. But he did that on my husband, Bill. He had to get extra bone.
Right.
Because he had lost a lot of bone around his hip.
Yeah.
And so then
I think
it stayed.
Where's Dr.
stayed.
Leon?
He's there.
Dr. Leon is there.
Got...
I think Dr. Leon, those orthopedic doctors, I think they wanted to be dentists. And they didn't want to work in a closed area, and they say, no, I'm going to work with big bones. But they do the same thing.
They
do the same thing.
Bone,
they
right,
fill in with bones.
And that's what you were saying about the teeth. Because people don't realize that. And so when they go in, the bone now will then, of course, build the ridge, as you said. Now they go in as though they can put the implants in.
Then they can put the implants.
Okay, but let's talk about people who have now had false teeth. All their life. Now they don't want false teeth anymore. Now what happens?
Well, what we do is we can put, they can put 2 to 3 implants on the top and 2 to 3 implants at the bottom. And then the denture get fixed for the implant. So you will snap on your denture into those little implants. You don't have to use any chemical to hold the teeth in place anymore. But not only that, the most important part of having your denture with an implant is the pounds that you can produce when you are biting. So when you put the denture with implant, you can bite much stronger now. You can shoot, let's say, a piece of steak. And before with the denture, you can chew on bread. Now you can shoot on steak. So it's a huge difference.
So do you still take your teeth out?
You can still take them out. You can take them out. You can clean, but they fit much tighter. Now you have teeth on you that fit much tighter to your.
Will you have people talking about this there?
We're going to be talking about any and everything, and any question that you have. RSVP to any of those numbers. RSVP on whichever is closer to you. And at least if you miss one, you know that you're going to have the other event. And because we're going to partner with the company, because one thing is when you sit down with the patient and tell the patient, this is what I can give you, the implant, this is the price I can give it to you. But you have the company right there.
Yeah.
And we're going to be there. We say, okay, well, let's work together with this patient.
Okay. Well, I want to now, before we run out of time, I want to tell everybody, get your pencils out. Friday, March the 24th, from 3 to 5, Boynton Beach. And the phone number to call there is 561-270-6494. And then if you prefer to
you have to RSVP.
RSVP, yes. Then if you prefer to go to the one in Fort Lauderdale, depends, whichever you want, that's going to be Friday, March 31st, from 3 to 5. And that phone number to call for reservations is 954-489-1345.
No, 25.
Oh, were we giving different numbers?
Yeah, this is the direct number to the dental. It's 954-489-2517.
Oh.
To RSVP for the dental implant.
We better do that again, 2517. So 489-2517.
Correct.
Oh, okay. And that's right. And then the wine and cheese reception is going to be very friendly. You'll get to meet Dr. Mencia. Many of you have not met him. You always want to meet him.
And you might meet Anita if we get her to come.
Oh, yeah, I'll come. Of course I'll come. Are you kidding? I would not come to any of the things that you do. I'll come to both of them. So you can count on that. So 3 to 5, March 24th, and then 3 to 5, March 31st. And we certainly hope we're going to see everybody there.
And what's the number they can text for the spa? To find out
the spa. You got to get beautiful. That's 954-561-8799.
And just text the word stone.
Stone. Oh, okay. 954-561-8799. If you haven't been to that med spa,
of course.
You're going to come out stoned.
Well, you're going to come out stoned, right? You're going to come out stoned. Well, if you're going to have your teeth done, you better have your face and everything else done.
Absolutely. Look at Ina implants, how
I
beautiful
know.
they came out. Look
Ina,
at those
Ina
teeth.
is fabulous. I was wondering about that. Ina looks great, and she's a very big part of the Stonewater Med Spa, too. So we thank you both for being here, and we will see you again next week.
And stay tuned for
Dr. William
Dr.
Leone.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.